Now we will have the first presentation. The scenery is the specialist healthcare services and the complex hospital organization. Our researchers have assessed and evaluated the implementation of a mobile app in clinical practice. Gro-Hilde Severinsen works as a researcher, holds a PhD, and is also a bioengineer. Silsand is a senior researcher, holds a PhD, and is a registered nurse. We will also meet Beate Sørslett, who is a medical doctor and works as a deputy CEO at the Nordland Hospital. Welcome, Gro-Hilde, Line, and Beate.
Hi, my name is Silsand, and today, together with my colleague Gro-Hilde Severinsen, we are going to talk about evaluating ICT implementation in complex healthcare organization. To do that, we will tell you about a research project where we evaluated the implementation of a mobile app for nurses in specialist healthcare services. This is an overview of the presentation and the topics we're going to talk about today. First, I will give a brief overview of the lesson learned from the implementation of a nursing app in specialist healthcare in northern Norway. First of all, the app provided users with instant value of improving the workflow without demanding reorganization of work practices. The implementation not only fulfilled the goals set by the organization, but generated several unintended values as well. And the hospital is part of a regional collaboration. And by implementing the app, it is possible for other health trusts in the region to do the same. And there was a need for extensive collaboration between different actors to use the mobile app and to support the successful implementation. And finally, a mature organization is an essential factor for lightweight implementation to succeed. And the last point is that implementing a mobile app designed for one specific purpose is a new way of supporting clinical practices. And this is a little about the background for why implementing lightweight technology is a way forward in the health ICT field. Large, heavyweight ICT constellations, like EHR systems, are becoming increasingly complex and rigid, and changing them requires extensive time and effort. Therefore, such solutions make it difficult for organizations to continue their digital development and adapt their ICT portfolio to emerging user needs. So over the last years, lightweight ICT applications like apps, complementary to the existing heavyweight ICT, are entering the e-health field. And these innovative and agile applications are meant to support defined and immediate user needs and work processes. The empirical site for our study was Nordlandssykehuset, one of the 4 health trusts in the northern Norway region. The trust includes 4 hospitals, employs about 4,000 healthcare workers, and provides services for around 140 inhabitants. The case we evaluated was their implementation of a nursing app designed mainly for registering NASSS score. The implementation was done between 2020 and 2021. NASSS is a scoring tool used to detect clinical deterioration in adult patients and is a key element of improving patient outcome and safety. The score is based on the registration of vital signs like respiratory rate, saturation, temperature, systolic blood pressure, heart rate, and a consciousness score. The value of the different vital signs are calculated into a total score between 0 to 9, which contributes to an equal understanding of the patient's status and how the situation evolved, and to that end, increase the patient's safety. Using the patient is a work task that the nurses conduct on all submitted patients in the health trust, both within somatic and psychiatric care. For all patients, this score is repeated a number of times during their hospital stay. And if the situation is unstable or critical, it is necessary to register the new score more often. So we established a research collaboration with Nordlandssykehuset starting in March 2021. And where the project period was finished in April this year. The goal was to introduce and use NASSS evaluation framework for evaluating the implementation of clinical ICT systems. Nordlandssykehuset had just implemented an app to improve the workflow for the nurses when doing the news score. And they wanted to evaluate the process to identify the success factors and the problem areas of such implementation, and to get a broader understanding of their implementation processes. So we had a very good collaboration with Nordlandssykehuset from the start. They wanted to learn more about how to evaluate their implementations, not just related to the numbers and measurable benefit plans, but also in relation to more qualitative parameters to get a broader understanding of the entire organization. We at eHealth Research wanted to evaluate the process of implementing lightweight technology into a healthcare infrastructure and to understand the socio-technical effects such implementation generates. And we have to say that we are very impressed by the way Nordlandssykehuset has opened their doors for us as researchers and always been positive and welcoming to us. We are also very impressed with how they run their ICT infrastructure as an ecosystem and how they plan for every new ICT device to be tailored to the existing system and work processes, so the new implementation will give value for their users. So I will now introduce Beate Sørslett. She is the medical director at the hospital, and she has helped us with access to recruit informants in the Health Trust, participated in the data analysis, and discussed the finding with us. In that way, she has quality approved the data for the papers we got accepted at MIE conference and eTelemed later on this summer. And now the medical director will present Nordlandssykehuset, the nursing app, and the motivation for learning qualitative evaluations.
Hello, my name is Beate Sørslett, and I'm working as a Chief Medical Officer and Deputy CEO in Nordlandssykehuset Health Trust in the north of Norway. My background is from medicine, and I have been working as a doctor in both Norway and Sweden using different IT systems. We have 4 hospitals in Nordlandssykehuset, 2 in Beate, 1 in Lofoten Island, and 1 in Vesterålen. We have large geographical distances with 500 kilometers from the northern part of the healthcare trust to the southern part by road. Traveling between Beate, Lofoten, and Vesterålen requires plane or boat. Partly because of this distance, specialist healthcare in the north of Norway and our healthcare trust in particular has a strong e-health and technological focus with regional and national solutions based on standard IPs like FHIR. We have DIPS Arena as the main electronic health record, and we have integrated other IT systems with DIPS to facilitate better and more agile work processes for our healthcare workers. We believe that it is good for innovation, quality, and price that different companies are delivering into our needs, given that they can integrate with DIPS Arena. We have a digital ecosystem, not one-suite solutions, and good knowledge about the possibilities and restrictions within the ecosystem is necessary to introduce new elements into it. We believe that a close correlation between clinical personnel and IT personnel is important, so that decisions and implementation plans are made with the knowledge from both groups. There are at least 2 large topics when planning for IT implementation in healthcare. Will the system implementation be possible, and if so, a success? And how can we measure the value of the implementation? I believe that in order for the system to give value for healthcare workers, and thereby also have a good adaptation, the IT system must be regarded useful and preferable better than doing it the old ways or in the old system. NASSS was used as a framework for evaluating our implementation of Medanet nursing app. This app is used to register vital signs like, for instance, blood pressure, temperature, and respiration frequencies, but also for different kinds of checklists for nurses. The doctors do not use the app, but do now get the results that earlier was on paper charts into the digital electronic health records. And this implementation has been regarded useful and time-saving for both nurses and doctors. The different parts of the NASSS framework have given us a broader understanding of why this implementation succeeded. This kind of evaluation is important for the next organization that will implement the same system. The technology is only one part of the framework. The other parts must also be discussed. Are the differences between the organization, like capacity to innovate, readiness for this technology, and to what extent must organizational routines change? And for healthcare organizations in other parts of Norway or other countries, are also the wider system a factor that can influence implementation? Technology, organization, and wider systems are only 3 of the domains in the framework. The next time we will use the framework to assess complexity and risk when planning, to increase the probability for a successful implementation. Some of the factors will be the same as with the MediNet's implementation, others will change, not only in technology, but also in other parts of the framework.
Yes, so when introducing new technology into healthcare organization, it is expected that complexity of varying degrees will occur. And as the CEO, Dr. Sørslett, said, it is important to understand why implementation might become a success in one department and not interpreted as a success in another one. And this is also why an evaluation of the processes are needed to capture and to get an overview of what is really happening, to be able to understand the connection between the different elements affecting each other. So in order to evaluate the implementation, we used the NASSS framework developed by Professor Teixeira Greenhalgh and her colleagues. Because NASSS is set to guide and evaluate the success or failure of technology implementation in organization, as well as assessing complexity related to the implementation process. Using the framework can help to predict and change direction during an implementation process and to stimulate the success of an intervention. However, in this project, we did the evaluation of the implementation process after the implementation was done, so we did not influence the implementation process as such. The framework includes 7 domains, like you can see on the slide, and it is identified through systematic literature review and refined through empirical case studies as of technology implementations. So the project is a collaboration between research and clinical practice. And we as a researcher have experienced that NASSS is a framework that also appeals to the clinicians and managers because they understand the categories and find them relevant. And as Dr. Sørslett said, there are 2 topics when planning for implementation in healthcare. First, is the implementation possible and will it be a success? The second is, how can we measure the values of the implementation? And that is an important question to ask because what is values in healthcare? Is it save time for doctors and nurses when doing different procedures? Is it to improve quality of the patient treatment and care? And how to measure that? So we believe that to understand the success or failure of an implementation, then it's necessary to do a socio-technical evaluation where you map out a broader picture of the implementation process to understand how the technology, the technical infrastructure, healthcare personnel and manager, actually the whole organization is influenced by the technology and how the organization will influence the technology as well. And the NASSS framework helped us in doing that because it includes categories that are useful when doing a socio-technical evaluation. So we have conducted a qualitative evaluation 1 year after the implementation was done. The interview guide was guided by the NASSS framework, and we have conducted 22 semi-structured interviews with different actors in the process. The interview data was transcribed and sorted into the different categories of the framework. And this is an overview of the interviews of the informants we have done and which kind of actors that was involved. We had in total 40 informants. And they were healthcare personnel, doctors and leaders, persons from the vendors, both the app vendor and the EPR vendor, as well as the ICT trust in Helsingør. So now we go back to the empirical project, and we will now play a short film from Nordlandssykehuset where the nurses tell about using the app.
Det gjør at jeg på en måte får kjenne mer på at jeg synes at det ok at jeg valgte den jobben som jeg gjorde. tidligere, når vi på en måte har tatt de her målingene av Italia, så har man jo skrevet det ned på et ark da. Og når jeg har vært ferdig med alle målingene og har ført de ned, så har jeg så måttet gått videre inn i pasienten sin journal, da fortsatt på papir, og skrevet det inn på papiret.
Hvor lang tid tok det før da?
Det er veldig varierende, men altså, det kunne jo være alt ifra at det tok kanskje 5 minutter fra man hadde tatt det til man førte det inn, eller at det skjedde uforutsette hendelser i mellomtiden som gjorde at det kanskje kunne ta flere timer. Kanskje endte man opp med, når man skulle føre det inn, at man var usikker på 2 av de. Var det hun på 412, eller var det han på 23? Altså, det er ikke bestandig at målingene i seg selv trenger å si deg noe, at det er så negativt. Men når du 2 timer etterpå fører det inn i en papirkurve som viser at på akkurat denne pasienten så har blodtrykket vært stabilt og normalt for hun eller han, men nå er blitt mye høyere eller mye lavere. Mens med medanett så kan man også se det umiddelbart. Altså det som er viktig er jo det at man sjekker at man har valgt riktig pasient ut ifra hvem det er man har foran seg.
Hvordan kan du gjøre det?
På de her ID-båndene som pasientene får når de blir lagt inn, så har de en sånn QR-kode og en strekkode da. Så man kan trykke at man ønsker å skanne, og så kan man skanne ID-båndet, sånn at, og da vil man automatisk komme inn på korrekt pasient. Jeg føler at jeg på en måte er mye tryggere at de målingene som er gjort kommer på rett pasient. Jeg har bare ett ledd, og det er den innføringen jeg gjør når jeg står ved siden av senga. Arbeidsflyten blir jo bedre. Det oftere blir enklere både for oss og for de vi jobber sammen med, altså legene. Fordi at de trenger på en måte ikke å komme hit, de kan gjerne sitte på kontoret sitt og gå inn på pasienten og se ok, dette er trenden, i stedet for at de må komme hit og se, eller at de ringer hit, og så må jeg fortelle de 14 blodtrykk gjennom de 3 siste dagene. Det gir meg rom til å kanskje få litt mer tid med pasienten som jeg kunne ønsket, enn det jeg ville ha fått hvis at jeg må bruke de ekstra 5 minuttene per pasient. Ja. Og noen ganger har 5 minutter veldig mye å si.
So now we continue to some of the results from our study. And the overall result is that this was a successful implementation. And that in itself is quite an interesting finding within digital implementations in healthcare, at least from our perspective and the experience that we have from previous implementations. Because most of the times it takes a lot of time to adjust the technology to the users, and to adjust the workflows and to get everything to work smoothly together. So this app implementation was a kind of a new experience, because often the nurses are quite skeptic towards new solutions, and they say, oh, do we need this new digital device, or what's in it for us, and how will this improve the quality of the patient care? But here we have some quotes from our interviews, and one of the department leaders says, I've never implemented something new that has been so positively received. It's simply the easiest we have introduced. And one of the nurses said, it was just like boom, and it was implemented. It meant that they didn't need to have a lot of practice before they started to use it. And it has worked very well. We started using it for news, and gradually more things were included thanks to the feedback from us. So they have included some risk forms and also other forms that they are working to include in the app. And one of the doctors said,
when he had talked about the implementation for a while, he said, when I talk about it, I can hear it sounds almost like science fiction. It was so good. And here is an overview of the nurses' response to using the app for registering new score. It was easy to use and intuitive to learn. It calculates the score automatically, and you don't have to do any paper registration. The score is instantly exported to the EHR and the electronic whiteboards at every department. And you find all new scores on all patients in the app. You get follow-up suggestions as decision support in relation to the score that you get. And there is no need for double registrations of the score. And however, not everything was positive, because sometimes the phones don't work and the network is down, and then you have to register on paper anyway. And nurses said it is dangerous to trust technology too much and forget to actually assess the patient, because if you are too busy with looking at your phone, you may miss some of the things that you normally see when you look at the patients and talk to them. And some find the app cumbersome, and they still register on paper to not kind of look foolish in front of the patient, as they say, and they insert the data to the app later on. And some find it impersonal for patients when you use the phone in their room. They say that we get used to using the app, but the patients don't, because the patients are new all the time. And they say that the app was not really very time-saving to use. And we see that the negative feedback mainly relates to the lack of digital maturity for the users, the organizations, as well as the technological infrastructure at the health trust. And one of the important goals for Nordlandssykehuset was exactly that, to improve the organization and users' digital maturity, to be able to implement more digital solutions in the future. And therefore, they also needed to test out the mobile infrastructure in the health trust. Since this was a regional solution, the regional ICT also had an interest in testing this out in a larger scale. And they also needed to test out making the complex integration needed for adding an app to the existing ICT infrastructure. And the EHR vendor, they wanted to use mobile solutions for parts of the EHR registration. And therefore, they also had an interest in testing out this mobile infrastructure. They were also interested in testing out the integration between the app and the EHR system, and also testing adding third-party vendors to their EHR system. And the app vendor, they wanted an access to the Norwegian market, of course, and they needed standards for exchanging the data from the app to the EHR and the electronic whiteboards. And to make the nursing app a success, it was important to provide a good collaboration between the EHR vendor, the app vendor, the regional ICT trust, and Nordlandssykehuset. And lightweight ICT facilitates shorter and easier decision and implementation processes. Nordlandssykehuset is a mature organization in relation to their ICT portfolio, as we heard from Beate Sørslett. And this makes them well prepared for implementing a nursing app. They have motivated users and motivated leaders. Still, they are one of 4 health trusts participating in a regional ICT collaboration in Northern Norway. And the overall ICT portfolio is regionally defined, and implementations of new systems are normally conducted in a regional implementation program, where all health trusts has to agree on the solution, and the implementation is often complex and time-consuming. However, the regional program did only include the large ICT systems, and starting to implement apps was a way of providing more flexibility and innovative ICT infrastructures for the health trust without damaging the regional collaboration. And also, when Nordlandssykehuset had implemented the app, this was ready for the other health trusts to use as well, because all the integrations and all the collaboration were established. So And in addition to fulfilling the expected benefits, Nordlandssykehus has defined before implementing the app. This implementation generates a set of ripple effects, which we identified by using the NASSS framework and the value category in specific. It was an improved workflow for the doctors, better overview for the department managers, improved collaboration between professions and units, and improved digital competence of the users, made them find more forms to include in the app. And I will come back to each and one of these in more details in the next slide. The first benefit related to improving the doctor's workflow. And even if the doctors didn't use the nursing app, implementing it had more positive impact on their workflow than expected. Now they received a new score and a patient instantly after it was taken. And as you saw in the film, they could also find a new score in the EHR at their office and didn't have to walk to the department to look for the paper chart. And it's now easy to find the trends for vital signs and news on a patient, since they are all gathered in the same document in the EHR. And it provides a good overview of the patient. And they say there are significantly less miscalculations and unnecessary calls from the nurses. And when they are on call, they can also check the news and the trends on the patients at other departments that they need to go and assess. And the next one is that the app improves a better overview for the department managers. They found it very easy to implement. It was time-saving to use, intuitive, and needs minimal of training. And it generated more and improved use of the electronic whiteboards they had on every department, since the data from the app automatically transferred not only to the EHR, but also to the whiteboard. And then they can use that to plan the day, because if they saw that one group of nurses had a lot of patients with a high news score, then they could move maybe one of the nurses to that group or the other way around. And it improved the overview of the workflow related to news, and gave an increased awareness and focus on news scores. And they said they had a good collaboration with the ICT in relation to support and maintenance. And next was the communication between professions and units was improved, like between the doctors and nurses, between somatic care and psychiatric wards, and between large and smaller hospital units. It was easier to collaborate through standardized language and objective parameters, instead of trying to explain the patient's status through parameters like he looks a bit shabby or pale or under the weather. No, they always had an automatically calculated, updated news score that instantly provided the correct result. And the doctor could look at news trends, for instance, when they were discussing if they wanted to transfer patients from intensive care to a department, from psychiatric wards to somatic wards, or from smaller to larger hospitals. Using the app also improved the digital competence of the healthcare personnel, and it made them suggest more forms and scores to include in the app, like height and weight and submission forms and risk evaluation. And when we talked to them and asked if they have thought about other things to include, they come up with a lot of suggestions that they wanted to discuss further with their department managers. And they said it was easy to collaborate with ICT and the vendors in making change to the app. The ICT and the trust considered the changes in relation to the overall effects for the hospital. They also prioritized the changes in dialogue with the vendor. And they said it was important that the app was flexible to change and evolve over time. And now we go back to the lessons learned. The app provided users with instant values of improving the workflow without demanding reorganization of work practice. The implementation not only fulfilled the goals set by the organization, but generated several unintended values as well. The hospital is part of a regional collaboration, and by implementing the app, it is possible for other health trusts in the region to do the same. And there was a need for extensive collaboration between different actors to use the mobile app and to support the successful implementation. A mature organization is an essential factor for LifeBack implementation to succeed. And implementing a mobile app designed for one specific purpose is a new way of supporting clinical practice.